COVID-19 pandemic. Expectant women fear contracting COVID-19 in hospitals or lack access to health facilities due to the nationwide curfew and cessation of movement in some counties.
Some have opted for home delivery and the results are turning out to be fatal. According to Dr. Patrick Amoth, the Director General, Ministry of Health, there has been a surge of stillbirths in the country since the confirmation of the first case.
With the outbreak and the night curfew in place, expectant mothers have been reported to be bleeding to death. A number are unable to make it to hospital in time, like in a case reported by KTN News on the 5th of April, where a lady in Makueni died because of delayed delivery. But Dr. Patrick Amoth says it is not strange and that it is bound to happen during any pandemic.
It's not a unique situation, Eric. Remember the Ebola outbreak of 2014?
Yeah.
I continue to tell people that more people died of non-Ebola reasons than Ebola itself in West Africa. People died of malaria, pregnant mothers died at home.
The Ministry of Health says the number of stillbirths in the country has hit its highest in the first quarter of this year.
That quarter was January, February, March, so we have that we can be able to share. But of note, what I picked off from that report that I can remember of it, because I'm not in the office now, is the increased stillbirth rates, which almost doubled during that period.
Many Kenyans are not visiting hospitals for fear of contracting the coronavirus.
I want to point out to you that we delivered the first COVID-positive pregnant woman via cesarean section about 8 or so days ago. At another university teaching referral hospital, both mother and baby are doing fantastic. But we also are working closely with the multi-agency team so that the curfew enforcers become our partners. But I don't think there should be any reason why Kenyans should fear to approach a police person or a police vehicle for assistance. In fact, the police should be able to facilitate transfer of a patient in the middle of the night for emergency care.
Dr. Amoth says the memo that was sent out to stop elective surgery did not suspend all surgeries, and neither did it stop Kenyans from visiting hospitals for other ailments. Healthcare workers are raising concerns that expectant mothers are reverting to the use of traditional birth attendants who are ill-equipped, risking their lives.
Some women will complicate inevitably, and that's why we advise them to deliver in hospital, so that if such comes, it is early picked and then treated.
With some critical services like radiotherapy and chemotherapy only found in specific hospitals in the country, the current movement restrictions are a challenge. Dr. Amoth says the curfew should not interfere with patients' rights to health.
Quite heartbreaking there. Anyway, as we go on for a break, we just want to remind you of our big